Hi, I'm here with Dr. Spike Briggs from Medical Support Offshore, based in Southampton, providers of medical kits, medical training, and also telemed support to the marine industry. We're going to be talking about the medical training that you should plan to undertake in order that you can deal with any incidents that happen on board. And if you have the kit and equipment on board your vessel, then you know how to use it to make sure you've got a really good outcome in the unlikely event of something serious happening on board. Spike, what's the main considerations we should make when planning our strategy for training preparations?
Well, I think it's based on on where the boat is, where it's going, how many crew, medical background of the crew, things like that, so that you can be as best prepared as possible. Whenever you go offshore, you're going to incur risk. But the whole point about having a medical setup or medical support on your vessel is that it mitigates the risk as much as possible. It won't eliminate it, but it will minimise it as much as sensibly possible. So exactly what you do in terms of medical kit training and telemedical support really it depends on the approach to risk of the skipper and the crew. Some people are more risk averse. Some people are very happy to take risk. So you end up with a reasonable size medical kit, or reasonable effective medical kit. But then what we're talking about here is training, and so what we are very, very keen on is that crew know how to use the medical kit. It's a bit like having a toolkit for the engine. There's no point in having a toolkit and not knowing how to use it. Our kits are laid out in a very modular kind of fashion, as I've explained previously, but even then you need to be familiar with the layout of the kit and where things are, just so that in an emergency you have the comfort of knowing where things are, and so you can respond adequately quickly. Our training courses are SDCW training courses. The content is dictated by the Maritime and Coast Guard Agency, and so the minimum course that I would think would be sensible for a vessel going around the world would be a 3.5 day medical first aid course, so proficiency in medical first aid.
When we're talking about training, there's obviously a different variety of courses available from both in duration and the intensity of the courses and what they're actually trying to achieve. So for an entry-level basic first aid course that might be delivered over the course of a day, which is just dealing with the very top level of possibly injuries that might happen on board. And then there's more developed courses in duration that probably get involved more in the illnesses and more severe injuries. What do you say to if obviously not everybody has the time to devote to a long training course? What would be the strategy with getting crew to attend those training courses?
Well, it comes down to attitude to risk, and some people will be very happy not to do a 1 day course, which probably a 1 day course is probably going to be more like a first responder type of course. So it concentrates on actions when you're faced with something, right in front of you. But the longer courses I think are more suited to dealing with situations which are going to be on board, ongoing on board the vessel and require continual kind of input.
We've been talking about medical incidents as a risk of going offshore sailing, and whilst the risks are that it should see more serious incidents be few and far between, what advice would you give to crews to prepare for an eventuality happening in terms of how they manage that medical emergency?
That's a very good question. So first of all, it starts off before you leave shore. It starts off with a conversation between the skipper and the crew about how their attitude to risk, and then how much medical kit they want to take, what kind of medical training courses they want to do beforehand, and whether they want to engage a telemedical support service. As well, so that's a conversation for the skipper and the crew because it's a joint kind of responsibility. But obviously the skipper is finally in charge of that. So I think all that needs to be done done beforehand. So having that conversation beforehand about the roles of each person on board the vessel if something happens. Of course, you don't know who's going to be either unwell or suffered trauma. So there's got to be some kind of consideration or discussion about who's going to step up in those circumstances, because it might be the skipper gets injured or knocked out or whatever, And so somebody's got to step into that role to have the overview of what's going on board the vessel. Doesn't get involved directly in doing something unless they really have to, but they keep an overview, and having somebody reliable on the helm as well to make sure the boat doesn't inadvertently tack or even worse jibe in these circumstances. But doing things like making sure you've got a stable working platform. So if you're beating up wind, just come off the wind onto a broad reach, reduce sail. Just so reduce the power of the boat entirely to make sure that that you've got a safe working platform. And the next thing is that if you have a casualty, or somebody who's unwell, have a thought about or have a think about where you're going to put them down below, which bunk is going to be the best place to put them. So it's obviously going to be somewhere near the base of the mast, so there's less kind of movement, or the least kind of movement, but it needs to be well lit, accessible, so that and safe, so the casualty doesn't inadvertently fall out of the bunk and incur more injuries, because they may not be able to look after themselves. So having some kind of idea about that, knowing where the medical kit is to make sure it's accessible, so you can get hold of it when you need it, and then you start instituting all the care system on board. But then the navigator, if you have a form of a navigator, would then be in charge of the outside comms. So making sure that the World Cruising Club control knows what's going on, that there's a medical incident on board a vessel, and then communicating in terms of getting further help if that is required on board the vessel.
Yes, I think it's being well prepared before you leave with that conversation about roles and responsibilities if something was to happen. And so if something does happen on board, you just got to make sure that situation doesn't get any worse. If something's happened, don't get off the foredeck to get to that stable platform you talked about. Deal with the casualty in a place that's accessible and is going to promote recovery for the casualty and allows the crew to give the best possible care and outcome to the casualty. And then you talked about communications outside, where, as you know, we're not the emergency services. That's the role of the MRCCs, but we're there with our rally control, ready to support maybe some of the illnesses that happen on board, or the incidents once they've stabilised, with maybe outside support from other vessels that are in the area, and they can come and give assistance. But what other outside assistances are available to a yacht, say, crossing the Atlantic?
So in terms of like an emergency, as you mentioned, it's a MRCC, it'll be a Mayday call, or next level down will be a PAN call, and that's looking for a nearby vessel as soon as possible. The next level down is using a telemedical support service. Now there are free services and there are commercial services. Obviously, my company, we provide a commercial service. So every maritime nation is supposed to provide a telemedical support service. So the UK Coast Guard does do that. France, Denmark, Norway, Spain, Italy, all provide free services. What I would say is just know beforehand about which service you're going to use, and to make sure that simple things like knowing the telephone number, so prior to actually needing it, and knowing how to use it is paramount importance. As I said before, it's all part of preparation.
My experience is most of the telemed services are accessible through the MRCCs. They work together, but I think having contact details for both is a good thing to do. And the MRCCs tend to organise themselves so that one of the MRCs will ultimately take responsibility for managing the incident, probably based on sea area, and they'll be the ones that then correspond with the boat to get an update on the situation. At the same time that a medical response might be talking specifically about the condition of the casualty or the injured. There's certain information that must be needed to be provided. So how does that conversation go? Obviously it depends on the incident, but how does the conversation go between a medical practitioner on board the boat? What does the medical practitioner need to know to give the best help? And then what does the crew need on board to respond to the advice given by the medical support?
Well, having like a structured report form is a very good idea, so that the crew have got some idea about what will be required. So certainly for our telemedical support service, we have a structured report form. In the ship captain's medical guide, there's a structured report form as well as reference, and in the skipper's medical emergency handbook, there's a structured report form as well, and so it just lets the TMAS doctor a kind of a structured kind of report, and tries to make sure that we cover everything that's required. So the basic things that we need to start with is we need to know the caller's name, the casualty's name, and preferably date of birth, the vessel name and location, and then level of severity of the case. Just a very straightforward kind of level 1, 2, or 3. So level 3 would be something which is life-threatening. Level 1 would be like a skin infection or something like that. And then we'd need to know exactly what's happened. There's a very good framework. I was talking about this previously, about framework within which to think. So that's the ABC, so airway, breathing, circulation framework. And so if it's a serious incident, you'd be looking to see, is the casualty conscious? Do they have an airway? Are they breathing? Do they have a cardiac output? Do they have a pulse? So that would be like a very straightforward way of assessing a casualty, and gives you an idea. You don't want to have a 10-minute conversation and then find out the casualty's unconscious. Following that, so having some idea about exactly what's happened, and then the suspected injuries, because we won't know exactly what the injuries are. Some of them may be obvious, so like a broken leg or a broken ankle, something like that may be very obvious, but there may be other injuries as well. So like a good going ankle injury, for instance, with a bone sticking out of the leg, that's a very good distracting injury, and it distracts you from what else might be going on. But that's the role of the TMAS doctor, is to be nice and calm and bring structure to the situation, so that they will ask structured questions about exactly what's going on, so they understand what's happened, the present state of affairs, and then they'll try and make a decision about what to do next. The other things we always need to know about a casualty are medical history, any regular medications, and allergies. The other thing I would say is that if you're making a call in, try to make sure that you're not standing on a very, very windy deck, and also not talking on a speakerphone is also very good as well, because the problem is with speakerphones on vessels, you get a lot of background kind of noise, and it makes it very, very difficult to hear exactly what's going on. So a nice kind of calm, quiet call, structured, means that for the TMAS doctor, they've got a much better chance of dealing with the situation. And this is even more so if you're dealing in another language as well, of course. So that adds another potential complication.
We talked about the passing that snapshot of information about the incident and the casualty then, but I think in a few experiences I've had about it is also managing the information as it goes on as well, in good record keeping of what the current situation is, maybe with an illness, an infection, just trying to maybe take some photos and monitor that as it goes on, or record this information from whatever period of time to the next. It seems to be that when you get involved in an emergency like this, it really helps to have like a timeline of how things develop. So doing it regularly, and have that dedicated person who's looking after the casualty care to record things, because it's then easier to find out if anything changed over time that maybe people didn't realise.
Yeah, that's a very, very good point in terms of time. Writing things down as you go along. So what medications have been given, what injuries have been found, where the casualty is, in what state they're in, on a continual kind of basis is very, very important. And the other thing, of course, is taking vital signs. So things like pulse, blood pressure, respiratory rate, temperature, oxygen saturations, if you have a pulse oximeter on board. Recording those when those measurements are taken is very important. And again, most TMAS services will have some kind of report form with a monitoring chart and what have you for continued kind of recording of the medical situation as it goes on. Because this may be just a few minutes, an hour, several hours, or it could be days, or even in very like going across the Pacific, could be a week or more on board. And so keeping what we call a contemporaneous record of what's going on, plus conversations is very important. You make a very, very good point about the use of images and video for recording situations. So our TMAS service, we use a lot of images from offshore sent on email, and we take telephone calls as well. So telephone calls, emails with images, and also occasionally video clips as well if required. They are very, very important. Very, very important. And in terms of recording something which has happened on board, that improves the advice that the TMAS doctor is going to be able to give you, and also it's a medical legal kind of record of what's happened as well, which of course may be required longer term. But certainly, if you don't do it at the time, it's difficult to reconstruct it later.
And also for assistance, you've got publications like Ship's Captain's Medical Guide and others. How would you describe those publications, and how can they help us in management of emergencies or in preparing for eventualities? I mean, Ship's Captain's Medical Guide is quite extensive, isn't it?
Yes, and so it's a medical manual. It tells you how to do how to assess stuff and how to do stuff. Whether you do things or not, that comes down to advice from a telemedical advice service.
So in our rally handbooks for the events, we've got a list of sort of like considerations for medical preparations, and including that's the Ship's Captain Medical Guide and a few other publications as well. Is there any others you'd particularly recommend?
Well, so obviously I was the author of the latest Ship Captain's Medical Guide, but I've also authored the Skipper's Medical Emergency Handbook, which is like a trimmed down version of the Ship Captain's Medical Guide. So that might be, it's a smaller book. It's available on PDF as well, or on ebooks and Kindle and things like that. It's a manual telling you how to do stuff.
So it's really good that people look at the manuals and read through and do some preparations on there, because of course we don't want people to be looking through books and manuals at the time that they're trying to help their crew member out with a medical emergency or an injury or an illness.
No, exactly right. So I think at the time, like the first responder time of the first half an hour, or a couple of hours, you don't really have time to get a medical manual out. So you've got to really know what you're supposed to be doing at those times. You can get somebody on the telephone to a TMAS service very quickly, of course, but certainly the medical manuals are further down the line.
So we'd like to think, with the equipment that we've got on board and the training and the preparations that we made, that if there was an illness on board or injury, that we could promote a good outcome for the casualty. But in certain circumstances, the yacht will need to progress to somewhere else to get some external assistance, and maybe transfer the casualty or the ill person to shore or to another ship. So what are the considerations to make about what happens once the casualty is moved from the yacht to elsewhere?
Yeah, so when something happens on board the vessel, the main aim on board the vessel is to make sure that we preserve the casualty as well as possible. We may not be able to make a diagnosis, and it may be that the casualty is okay to stay on the vessel, but it may be the case that the casualty needs to be evacuated off the vessel under the arrangements of MRCC, or the vessel goes to the nearest port as soon as possible. But then that raises, if they've still got a medical problem, that then raises the possibility, or the probability, I should say, of requiring treatment in a local hospital, which may be a government hospital or it may be a private hospital. But there's always a distinct possibility that costs will be involved at that stage, and they will not be cheap. And then, of course, once the casualty is stabilised, there will be a requirement to repatriate the casualty back to their home country. Now, they may be able to travel just by themselves on a commercial flight, or they might need proper medical repatriation, and that is very, very expensive. So what I would advise is that all the vessel insurance or the crew insurance covers both the possibility of requiring medical treatment on shore at a local hospital, wherever that may be, but also it covers the possibility of repatriation.
Spike, thanks for the time. Any last top tips you might want to pass on to our participants?
Don't get injured. Don't get bitten by anything, shark or mosquito. Get your vaccinations and have a proper medical kit on board, and then make sure that you're properly prepared.
Spike, thanks very much. That's a nice one to end on. I think let's keep it in the perspective that medical incidents while sailing, they do happen, but they are few and far between, as we've heard from our statistics earlier on. Many boats sail around the world with just minor things happening on board. The important thing is that if incidents do happen, illnesses or injuries, that we've thought through the preparations and we're better able to deal with the casualty or the patient in their time of need. So please do think about your medical preparations before you, as you're planning your offshore sailing campaign. Make sure it doesn't get lost within all the other things that need to be thought about. And it just gives you the peace of mind that when you go offshore sailing, you've got that area covered as best you can, and you'll be better able to react to any incidents that happen.